Hi, this is Lindsay Sullivan back at Bone and Joint Institute with our monthly Facebook Live series with our physicians. So today we're with Dr. Cory Calendine and we're talking about virtual reality, something that you don't really put hand in hand a lot of times with orthopedics, but he's got some really cool things to talk about today. So Dr. Calendine, thank you for your time today. We appreciate it. So before we get started on virtual reality, tell us a little bit about yourself, a little bit about your specialty here at Bone and Joint Institute.
Yeah, I mean, there's a lot to know. Most of it I don't want you to know about me, but no, truly, I'm an orthopedic guy here. I focus on hip and knee replacement. I guess I joined the practice in 2007, back when we were under a different name. The Bone and Joint Institute, of course, had been in this area in Williamson County for years and years and years, I think dating back to 1979. So
you're correct.
That's been cool to kind of be in one community since I got out, not in 79. I was 4, but I've been practicing here since 2007.
Okay, well, awesome. And again, like you said, hip and knee replacement is kind of your specialty, or it is your specialty.
Right.
So you've moved in kind of the robotics realm as well, with Mako and everything like that.
Yeah, I mean, technology is interesting, right? I mean, we were talking earlier before we hit play about the iPhone 6, you know. I don't think anybody has the iPhone 6 except this guy. He's on the other side of the camera, but you know, iPhone 6, we think, oh, that's old technology, but the reality is the technology in the iPhone 6 is 120 million times the computing capacity that NASA had when we put somebody on the moon, right? So it's incredible what technology is doing and the improvements that we're making. I think I'm on 13 now or something, or maybe there's a 14. I don't know.
We'll talk to Apple about that one.
But the reality is technology is advancing in every area of our lives. And why wouldn't we use technology to help us with orthopedics, right? What could be more important than serving our patients? Right?
Absolutely. So let's start talking about that tech. Let's talk about virtual reality.
Yeah.
It's not something that you typically put hand in hand with orthopedics. So first of all, what is VR, virtual reality or VR?
Right. So I mean, most people probably know like Beat Saber or something like that. You know, we know virtual reality from the gaming world. So the concept of virtual reality is you're in a completely immersive environment. So, you know, there are movies about this like Ready Player One and all that, but it's actually very applicable to orthopedics, and we'll talk about that. But what we're talking about is using one of those headsets like the, well, we're on Facebook, guys, and a partner. But we're on Facebook, and now it's Meta, you know, Meta's Oculus. where you're actually closed off from the world around you. And if you've ever been in one of those things, it's a little bit bizarre because literally people will be beside you and you won't realize it. You kind of get lost in the virtual world. So the whole concept of virtual reality is complete immersion into a, well, virtual world.
Virtual world. Okay. Yep. So talk to me about VR and orthopedics.
Right.
How do we, or how have you started to use VR in ortho?
Yeah, it's a good point, right? Because we're talking about immersive into a virtual world. How does that apply to surgery? Well, it's because of the training side. So we've already used these virtual reality programs to train like residents, right? And that makes sense because if you have a surgeon doing an operation on you, you probably want them to have as much practice as possible, both on other patients, right, before they get to you, but also in the virtual world. So the virtual world allows you to, obviously without the involvement of an actual patient, go through the steps of a surgical procedure. So we've been using virtual reality for surgical training for some time, right? And we all know about, you know, COVID limited how much access we had to care, and the volumes of these training procedures went down. Well, how did we supplement that? Well, we supplemented it with virtual reality in surgical training. But what you may not think about is in my world, so I'm old now. I've been here since 2007. So there's new technology always coming out. So the question is now becoming, how do we use virtual reality to teach the surgeons the new technical side of things, right? So we mentioned robotics earlier. So what we're doing is we used to train surgeons on the new robotic platform using cadavers, right? Which is maybe kind of a gross thought for some of our viewers, but kind of commonplace for how we train. In order, it's a safe environment, obviously, and we don't have to worry about that patient's outcome as far as, so it's a good training environment. Well, now you can do that training in the virtual world, so you don't have to utilize that important resource of cadavers. And again, also, you can do it anywhere, anytime. There are even these cool things, we call it the collaborative mode. So I've done this frequently, so I'll be at my home in Brentwood, and I'll drop in on a surgeon who is actually physically in, say, Australia, and he and I will both be in the same operating room in the virtual space, exchanging, you know, tips and tricks, if you will. So it's a powerful tool to train not only residents as they start, but also surgeons as new technology is coming out.
Have you seen this in, I know we're in orthopedics, but have you seen this in other surgical specialties?
Yes. Yeah, it actually probably has its earliest roots in general surgery, believe it or not. But ortho is kind of really blown up with it because we're such a technical discipline. We have saws and things, and there's so many manual things that we do that are applicable immediately to the virtual space. But now we're seeing more even in radiology and endovascular procedures, GI procedures. It really is expanding. The concept is anytime you want to practice something, you can do that without a patient in the virtual world as many times as you want. That seems to be a good thing.
Okay, and it, like you said, not just for residents, but also physicians that have been practicing a while, just for good practice, and as new tech comes out, which is awesome.
Well, that's exactly right. And I know this is a monthly thing for you guys on Facebook Live. I don't know that I've been invited before. Maybe I have and I've forgotten. But one of my other partners, more advanced in age, shall we say, a brilliant surgeon who has great practice in the robotic space. He was skeptical. He was like, man, I'm going to put this thing on and get in the virtual world. Well, he was in there about 5 minutes, loved it, which was kind of cool because it's such a believable experience. But then he goes, he's finished, and he goes to set the controllers down on the surgical table. Well, remember, he's seeing the virtual world. So he sets the controllers on the table that's actually not there. He drops them to the floor, they break. I replaced them, no problem. But I'm just trying to make the point that it's actually much more realistic than you think. So there are probably some people that are like, you know, virtual reality is for gamers or what have you. It actually is quite convincing. And isn't that what you want for your surgeon, you know, to be fully convinced? You want it to simulate the actual procedure.
Absolutely. Yeah. So where do you see the like this is awesome and how technology has come so far, but where do you, and we won't hold you to this, but where do you see it going?
Yeah, I think it can only expand. You know, right now we're using it for training, right? Residents and the new tech. And I think that's going to expand, of course. But, you know, and this is a little bit of a fringe concept, but the reality is within the virtual space, I can track every movement that the surgeon makes. So actually, we can test surgeon proficiencies, either as they start the procedure or as they get older in life and maybe lose some of those technical skills. The reality is we could use it for the betterment of our patients. We could actually have real, objective, measured data about how well we're doing as surgeons. So I think there's a huge education piece, but I think it's also how we can maintain our standards. You know, surgical disciplines are a little bit different, right? They take not only this knowledge of what you're doing, but this technical aspect as well. And that's where virtual reality can really help.
Awesome. Awesome. And the last question that I always ask during our Facebook Live series is Bone and Joint Institute offers comprehensive care. We're between our urgent care clinics, our main clinic, our surgery center, our rehab. How does the comprehensiveness and the addition of technology, how does that help our patients with the best possible experience?
Well, I mean, care is complex, and the unique thing is you can know a lot about the books and all that, but everything has to be individualized for the single patient, right?
Absolutely.
And so oftentimes what we do is, we'll see them in the urgent care. That's where we start. We have subspecialists. You know, if you have hip and knee pain, you should call me. If you have shoulder pain, you probably shouldn't listen to me. You know, we just have areas of subdiscipline, and that is only to serve you. But how do you get here? Urgent care clinic, okay. And then how do we treat you with therapy, hopefully without surgery, right? Believe it or not.
That's our goal.
A lot of surgeons on staff, but our goal is always to maximize things short of surgery. And so we want to make sure therapy is optimized. So that's why we've grown into that space. I think the ability for us to be kind of a one-stop shop, and you know, surgeons have control issues anyway, but they're in this scenario, we're trying to control the care for the patient good.
Absolutely. Well, Dr. Calendine, as always, thank you for your time. We appreciate it. And we will continue to do this series every month as we come along, but for questions for Dr. Calendine or to schedule an appointment, you can go on our website, boneandjointtn.org, or give us a call at 615-791-2630. So until next time, Thank you again.
Until next time. Thank you all.
Thank you.